Our services at Southeastern Regional Medical Center in the Medical Imaging Department offer a wide spectrum of all imaging modalities that you would find in any large medical center, from basic X-ray service, ultrasound, nuclear medicine, special procedures, CAT scan, MRI, PET-CT, and we also offer full nursing service as well as transportation services. We're very involved in patient care from the time the patient is admitted till the time the patient is discharged. We're very integrated with all of the services provided here at the hospital. We not only see our inpatients, but we also see emergency room patients and outpatients. All of them, I'm hoping, believe that they're our number one priority as we try to get our patients done safely, compassionately, and efficiently. Over 2 years ago, we purchased the 64-slice CT scanner from Siemens Medical. Rather amazingly, we were the first hospital in this entire region of North Carolina to obtain a 64-slice CT scanner. We were a year to a year and a half ahead of Cape Fear and also New Hanover in obtaining this technology. The 64-slice scanner is so important for us to be able to provide prompt heart care for our patients, because what the 64-slice scanner does, within a 14-second scan, it stops the motion of the heart enough because it takes images so quickly that with one breath hold, we're able to acquire hundreds and hundreds and hundreds of slices of information of the heart so that we can evaluate the coronary vessels and look for any damage to the heart walls or any blockages in the major arteries of the heart. Having the ability to have a scanner acquire that much information in such a short period of time is critical to provide CAT scan imaging of the heart. And the 64-slice heart images are just a portion of how our physicians and other care providers will diagnose and treat those patients, because we also continue to have heart catheterization services here through our heart center, as well as our cardiac echo studies, as well as our nuclear medicine cardiolite studies. And all of those combined give us one more tool in the toolbox to help those patients. And one of the aspects of the 64-slice that I think is even more important is it's so non-invasive. Within a 14-second scan, you can see all unbelievable amount of detail. But it's very, very important to be able to see that kind of three-dimensional data and images in a way that totally revolutionizes patient care, and the ability to have a patient walk in, have their heart being monitored by a nurse and a cardiologist, taking the images of that heart within 14 seconds, that patient is out the door in under an hour from the time they came in to the time they leave. They're in and out, and yet we have obtained as good image quality as a heart cath in some people's opinions. It's just a beautiful thing to be able to provide that service to our patients. Some of the tests that we offer that are rather unusual for a hospital of our size, we do have a mobile PET-CT scanner, which comes every Tuesday. And we're one of the hospitals in the southeastern portion of the state that get the opportunity to use this unbelievably high technology. And the PET-CT scanner basically is a hybrid between a nuclear medicine study and a CT study. In the nuclear medicine study, we inject radioactive sugar into the patient's bloodstream. Sugar is highly metabolized by very fast-growing cells. Primarily, the cancer cells in your body are highly growing. So when we inject radioactive sugar, we're able to actually image the cancer cells inside the patient body, as this radioactive sugar will go straight to those cells, and we can image them in concert with a CT. We can then get a three-dimensional image to help our radiation oncologists and our surgeons do better cancer treatment planning for those patients. All of our services in the department, we offer high-tech in every area, from the X-ray department, with us being filmless, to our four-dimensional ultrasounds in the ultrasound department, which allows us not only to have 3D imaging of the anatomy, but also 4D, and 4D adds the dimension of time, which they call temporal resolution, so that you not only get three-dimensional, but with time you can actually see movement in motion. So the ultrasound department is high-tech. We're state-of-the-art from stem to stern in the department. And I'm just excited to be able to work with such a fine, dedicated group of professionals in my department. All 90 employees in that department and my 6 radiologists. They allow us to take that high technology that we have and transform it in a way that is safe, compassionate, and efficient for our patients. And I've got the best staff in the world. And in my 30 years of being in radiology, this is the best group of people because they truly care about each and every one of those patients. So it's one thing to have high tech, but it's another thing to have that high tech with people who really care about what they're doing and to be able to apply that high tech in a way that actually makes that patient's visit a much better situation. The decision to go from film-based imaging to digital-based imaging was an easy decision to make, but a difficult one to implement. Film inherently is a great imaging medium. It can take a lot of abuse, it's durable, but there's one problem with film. And the problem with film is if you have my X-ray film, no one else can have it. And if you lose my X-ray, you've lost my data. Digital imaging provides portability. It also provides ease of access from multiple users simultaneously throughout the enterprise, so that you could literally have 5 physicians looking at that X-ray at the same time throughout the United States and not have to worry about where's the original. So mechanically, the problem with film was it was expensive. There was a lot of maintenance on the equipment to keep it up and running, and there was always that potential for that one, the only and the original film, to become missing, misplaced, not where you wanted it to be, and someone is waiting, tapping their foot, waiting for that image to be delivered. Digital imaging, computed radiography solved that problem for us. And we've been filmless in the X-ray department for just about 2 years now. And I think that we could not operate now without being filmless because of the amount of efficiencies that we gained by being able to electronically move images. The cost savings have just been dramatic, as well as the time savings for our providers. The benefits for the patients in a computed radiography or a digital imaging environment are many. The first major benefit is as soon as that image is taken, it's available to that physician to interpret, our radiologist to interpret that film. In the past, X-rays done at our outside clinics may have to wait a day before a radiologist would see them because those films would need to be physically moved and handed to the radiologist. Now they're available within minutes electronically. So that's one benefit, is their images are able to be viewed much faster. The second benefit to the patient is we can give them multiple copies of that study if they desire. And we give patients their images on a CD now. And you take that CD and you take it to any doctor and they put it in their computer and it auto-loads and auto-plays. I think the public can look in the future to seeing medical imaging departments becoming faster, more efficient, less paper, less duplication of questions, and that with the integration of data, that their whole patient experience is going to be streamlined from the time the doctor makes the decision that the study needs to be done until the patient arrives, until the patient leaves. Things are going to happen much quicker that used to take a while manually.